few of us here.
Let me know when you want me to let them know that there's interpretation available.
Oh, in fact, Miguel, why don't you go ahead and do that now? Thank you.
Sí, buenas tardes a todos. Para la junta de hoy habrá interpretación en español disponible. Solo necesitan que ir a la parte de abajo de la pantalla, presionar interpretación y luego escoger el lenguaje de español. Ya en ese entonces se moverán a otro canal diferente y me escucharán a mí nada más.
Thank you, Miguel.
Yeah.
And Highland, I think Miguel is ready to move over to the interpreter channel.
Yes, please.
Got
Great.
it.
And while he's working on that, I'll go ahead and get started. So thank you, everyone. My name is Elizabeth Mazzara Myers. I am Chief of Staff to Chair Harrington. I am thrilled that you were all able to join us this evening for our very first ever Washington County Town Hall that is both virtual and simulcast in Spanish. So lots of firsts here tonight. I wanted to just give you some information about how the meeting will run, some ground rules, and then I'm going to turn it over to the chair. So first, the ground rules. We've got a lot of folks online joining us tonight, which is so exciting. But I do want to remind you that this is the first time that we're doing this, and it's new technology for us. Might be new technology for some of you. So I'd like you to be patient with us, be patient with yourself, and be patient with one another. So thank you in advance for that. There'll be an opportunity for you to ask questions. We'll ask you to do that in the chat box. If you're not sure where the chat box is, if you're on your screen and you move your mouse around, right in the center, third to the left, you'll see chat. That's where you can click. And if you want to put a question in there, staff will be monitoring that and we'll get that to the chair. As Miguel said in Spanish, I'll say it in English. We do have Spanish interpretation available. If you need it, on that same dialog box, second to your right is the interpretation button. You can click that and Miguel can help you. So thank you so much for coming. Our run of show will be very simple. Chair Harrington has a short presentation to provide some information that we know a lot of folks have been asking about. Then Philip Bransford, who's our Chief Communications Officer for CAO, has been collecting questions in through the email inbox. So he'll address some of those to the chair. Then we've got Erin Doyle, Jajit Nagra, and Paige Spence, who are going to help me move through the chat questions that you all submit to ask the chair, and then we'll have a closeout. I'm seeing that we have 114 participants with more waiting to come in. So this is just tremendous and exciting, and thank you all. And I'm going to turn myself off and turn it over to the chair now.
Elizabeth, can I ask a question?
Of course.
It's my understanding that if folks have any difficulty with Zoom, can they also go to the county YouTube channel to view this as well?
Yes, thank you, Chair. That's right. So we are also broadcasting this live on our YouTube channel. If you have any questions during this, please put it into the chat. And I'm wondering, Highland, I'm not sure if you've muted yourself. Do they have a way to get in touch with you if they have technical issues?
Sure. If folks have any issues, they can let us know in the chat box, and perhaps we can send them links to Zoom or help the best we can.
Great.
And we can also probably put that YouTube link in the chat box as well.
Great. Highland, could you take care of that? And Chair Harrington,
Sure.
I know you've got some slides to share in your presentation, so I assume that's all set on your end.
Thank you. Well, first on the YouTube channel, the easiest way I have found it is to go to youtube.com and search for Washington County. Or you can also go to the Washington County webpage, co.washington.or.us, and look at the county calendar, because we have meetings right on our website that use YouTube as well. So on the Board of Commissioners page, I think you can find it. Enough logistics. Let's get on with the show. So good evening, everyone. I'm Catherine Harrington, your chair of the Washington County Board of Commissioners. And I would like to also acknowledge my fellow board colleagues, Commissioner Dick Scouten, Commissioner Pam Treese, Commissioner Jerry Willey, Commissioner Roy Rogers are also on this call. The 5 of us make up the Washington County Board of Commissioners. Tonight, I have a short presentation to take you through this evening to help all of us better understand what's happening with our community, with our state, with regard to this COVID virus. And I very much look forward to your questions later. I really appreciate all of you joining us this evening. As mentioned, this is our first ever online virtual town hall that's also simulcast in Spanish as well. And I'm just so thrilled that you've taken the time to join us. Would it be possible for the slides to be available for everyone now? Great. Here's the very first slide. So here we are. You can see I like the color pink because it's there on the first slide, the advertisement of this event. And I have pink on again tonight. You could see my pink mask. Next slide. Oh, see, we're working out the kinks. I need to ask them to advance the slide. We're figuring that out. Whoop, there we go. Good evening and welcome, everyone. I think I've gone through that slide okay. On to the next. So, first, I want to thank all of you for the tremendous efforts that you have made in response to this very unwelcome guest, this new coronavirus that we now refer to as COVID-19. Our very first reported case here in the state of Oregon was here in Washington County, a person, an individual who lives in Washington County and worked in Clackamas County. Our public health team got busy right away, interviewing that individual and finding out who had been in contact with this person. The good news is this individual has now been released from the hospital, and we're grateful for that. Very quickly, Washington County activated its Emergency Operations Center, which handles our incident response for emergencies like this. And the following week on May 4th, your Board of Commissioners declared our first state of emergency. So here we are. As time went on and we learned more about this virus, particularly we learned about how it's transmitted. We now know through droplets. We didn't know that for the first couple of weeks of March. Then our governor limited large gatherings to try and slow the spread, closed schools for a few weeks through spring break especially. And then on Monday, March 23rd, she issued an executive order, 20-12, that we now refer to as Stay Home, Save Lives. And the intent of that was for all of us to do our part to flatten the curve, the incidence of the community spread of this virus, particularly to preserve our hospital capacity. You might recall that just a short 7 weeks ago, we were incredibly afraid that we were going to overwhelm our healthcare system here in Washington County. The good news is you did all that you could. Businesses closed, schools closed, you cooperated and you stayed home. Some folks were merely inconvenienced. Others have experienced tremendous hardship. And I want to thank you for answering that call, for keeping the incident rate closed. But let's not forget, some people are actually dying, and that's very sad. Just this evening, I learned that Oregon has, it's just over 130 deaths. Our 130th is right here in Washington County, an individual that did not have an underlying health condition. This worries me. I worry for all of you. I worry for you. I worry for your families. I worry about myself, my family, and friends. So here we are, now on May 11th, not quite the middle of May. We know that our governor just last Thursday announced some new requirements so that we can work towards a new normal. And I would like to take you through details of that. Next slide, please. So here's a brief summary that you can find on the website coronavirus.oregon.gov. It lists out some of the factors that we need to make sure we are prepared for and address so that we can continue to reopen the state of Oregon and build a safe and strong Oregon. We have to be watchful and mindful of the fact that this virus continues to be in control. We continue to have new cases right here in our Washington County community. There are people who continue to have such severe cases of COVID-19 that they have to go to the hospital. The rest of us are asked to continue to practice physical distancing, to be meticulous about washing our hands, and to wear face masks. But because of your efforts, we've had time to get more safety equipment in place for doctors, for our first responders and healthcare workers, and to make sure that we have enough hospital beds. We have to be mindful as more businesses reopen, as each one of us goes about living a more normal life and not just staying home, we're going to have more complex interactions with one another. And that's why each county has to be prepared with these different factors. Next slide, please. So what about Washington County? Well, the governor announced the prerequisites that every county, all 36 counties in Oregon, need to meet. But we have to remember that Washington County, like our two sister counties here in our greater Portland metropolitan area, Multnomah County and Clackamas County, we are far more urban. We have a much bigger population. And therefore, we have more cases of COVID-19 than other rural parts of Oregon. That's why we have to work harder in order to meet these requirements. And it looks like we may be opening a little bit later than many of our sister counties here in the state of Oregon. Next slide, please. So one of the things we've had to do is put together a reopening plan. Our great Washington County staff has been working on all of the pieces, all of the different prerequisites that we need to meet, and to imagine different scenarios. You know, what happens if we all go to different birthday parties, or we're all working in closer proximity? What happens if we have a surge all throughout our community? We have to be prepared for that. So our staff has put together a draft reopening plan, and tomorrow our Board of Commissioners will be reviewing that plan in a meeting with our staff. If you're interested, you'll be able to listen in on that meeting on our YouTube stream. And there you see the logistics for that. You can go right to the Washington County website, co.washington.or.us, and click on the calendar that's right at the top. Next slide, please. So what about some of the factors that the state is now under? Well, as I mentioned earlier, the governor issued her Stay Home, Save Lives order back on March 23rd. But she's changed a few things since then. On March 1st, she instituted a new executive order that allowed non-emergency medical procedures. Many times we refer to that as elective surgery, for example, but it also allows dentists to open up for those appointments to happen again, but at a lower capacity, as long as they have the necessary personal protective equipment in place for their staff. On May 5th, certain state parks started to reopen for day use and so forth. And our state parks department continues to try and get more and more facilities online. Last Thursday, the governor announced that more retail businesses can reopen starting this Friday, May 15th. You may recall that with that executive order to stay home, save lives, there were a whole group of retail businesses that the governor felt had high touch, high contact when you do those things. So she said, sorry, folks, you have to close. We need time. Well, the governor and her experts have decided that as long as these retail businesses follow these occupational safety and health authority guidelines, that retail businesses, so stores beyond grocery stores, for example, furniture stores, jewelry stores, that they can open up. Now, our staff has told me that since that announcement, our phone lines have been ringing like crazy, because lots of businesses have been asking, do we qualify as a retail business? And this is where I want to refer folks back to coronavirus.oregon.gov. That is the place where you'll find the specifics about the retail guidance. And you as the business owners need to make that decision. Next slide, please. So what about other businesses, other standalone businesses? Well, so you see here that we've talked about furniture stores, boutiques, art galleries, and jewelry stores. They can open as long as they follow those distancing requirements, have face coverings for their customers, and have safety protocols in place. There are also specific criteria that child care facilities, summer camps, and youth camps and summer schools need to meet. Once again, they have to follow a specific set of criteria, and the state website is where you'll find those criteria. And the state has been updating that webpage to try and make it more clear which criteria are already defined and which ones are still under definition. But once again, these are state-level requirements. Next slide. So what about other businesses in Washington County? What we're asking all of you to do is to prepare. We need you to prepare and be ready, because once we get approval from the state to open, you're going to get to open. So please get ready. There's a lot for different businesses to figure out: how to implement that physical distancing, how your employees will be safe, how your customers will be safe. And frankly, one of my concerns is, since retail businesses get to open this upcoming Friday, what's that going to be like? Are we going to all start overwhelming our stores? What happens if we find out that we have an increase in COVID cases as a result of more of that interaction? Well, guess what, folks? We, Washington County, have to imagine that scenario and have those kinds of scenarios planned out for in the reopening plan that we have to submit to the state. The thing I would like to avoid, and I bet my colleagues would be right there with me, we want to avoid closure. If we aren't successful in getting through this phase one, that means we have to go back and close again. We would rather not do that. So this is where you and I rely upon one another as a community to make sure that we're going to be successful individually, as families, and then collectively as a community. Next slide, please. So when businesses reopen, they need to make sure they meet the state guidelines for that safe interaction. As I said, for their customers, for their employees. and make sure that their employees wear face coverings, and to make sure that that physical distancing can be met as well. And remember, face coverings really come into play for those interactions where you can't guarantee that you'll always be 6 feet away from one another. So I know I have my face covering around my neck right now because there are some interactions just in setting up for this evening where staff and I were within 6 feet of one another. Well, let's get right to the prerequisites that we need to meet, because it's a little complicated. Next slide, please. Yep, here we are. These are the 7 prerequisites that the governor has put in place. And you, like I said, you can find more information about these on coronavirus.oregon.gov. Declining cases. Well, we were doing pretty well on this, but we just had a blip as of today. So we're double checking in with the Oregon Health Authority. Does that mean we have to go back to 14 days or what? Testing capacity. The good news is we now have more of those test cartridges all throughout our state so that we now satisfy the state requirement of having 30 people per 10,000 residents to be tested. Contact tracing, this is the one where the county really has to invest further. We have a great public health team. They work on doing contact tracing of communicable diseases every day. They have years of experience with communicable diseases like tuberculosis. We have 5 epidemiologists and nurses who do this work on a regular basis. So when we started having COVID cases in our community, more of our public health staff started being put into service to do this COVID tracing. And we even had a volunteer medical corps help us with the volume as well. Right now, we have 40 people doing this contact tracing. But the state is requiring that in order for us to reopen, we have to increase that level so that we have 30 testers per 10,000 residents here in our community. That means we're going to have to hire more community-based health workers, caseworkers, and about 40 more nurses. That's a lot of new personnel. And not only do we have to hire them, but we have to make sure that we have all the computers in place, that they're trained in interacting with the state database. And we need to make sure that we have enough folks who have multicultural experience and that are bilingual. Because as you well know, Washington County is a beautiful, diverse community. And we need to make sure that we are treating people fairly and comfortably. I mean, let's face it. If you're sick with COVID, we're going to be calling you and we're going to be knocking on your doorstep to find out who you may have come in contact with. And our public health team just shared with me today that just as one person, right now, on average, there are 12 people that one person during Stay Home Save Lives has come in contact with. And then there are another 15 people that may have had contact. And that's under our current conditions. It's going to get more complex, and we're going to have a larger volume of people. That's why we have to prepare. Preparing does not mean we're doing nothing. It's like we're putting a seatbelt on, getting ready to drive a car, to take that trip. So we're doing the work that you want and need us to do. Isolation facilities for those who test positive and cannot self-isolate. If you have a large number of people living in a home and you're not able to self-isolate if you're sick, the county is here to help you. Prerequisite number 5, this is for those businesses that need to adhere to their sector guidelines. There are different guidelines, whether you're a retail business, an outdoor or recreation, or if you're in personal services. For example, if you're a hair salon or a nail salon, you have different sector requirements than restaurants do, for example. Sufficient healthcare capacity, this is where we're dealing with the needs on a regional health basis. We're clumped together with 5 other counties. There are 6 of us: Washington, Multnomah, Clackamas, Clatsop County, Tillamook County, and Columbia County. Why? Because we have a hospital capacity of this region. And it's a region that the state has had in place for us for past crises, and we're going to get through this. Sufficient PPE, our Emergency Operations Center has been on top of this from day one. We've had more shipments in. They've made sure that our first responders and hospitals have what they need. We're in good stead here. So we're close, but not close enough. Next slide, please. So I talked a lot already about contact tracing. We've got folks to get on board. It's going to take a few more weeks. Like it or not, the calendar tells me a few more weeks takes us out to early June. It could be as late as mid-June. We're all anxious to do this sooner rather than later, but we have to make sure we have the right preparations in place because we have to satisfy state requirements. Next slide, please. So we all have a role to play in getting to a new normal. There is no going back to the way it used to be. We won't truly be safe until there is a vaccine available throughout our community for this virus. We don't have one now. So what we're trying to do is reopen in a way that is as safe as we can be. This requires that you and I as individuals, businesses, and as a community, that we take steps. We have to keep practicing that 6-foot physical distancing. We have to be meticulous about washing our hands. And we have to wear face coverings whenever we're in public. It'll be especially important that we work together to make sure that we are doing what we can to protect the historically underserved and our high-risk populations, because they're more likely to have the serious complications from this disease. They could suffer, they could die. I'm sorry to highlight that. I don't want people in my community to die. So please, let's all do our part. Next slide. We're coming to the end, folks. I want you to know, I believe we can do this. I believe that if we're careful and if we have the right preparations in place, that businesses will be able to open, that someday we will be able to go to the coast again, that someday we will be able to go hiking again in the beautiful gorge in the Coast Range. We will be able to get out and about and visit with our friends, but we need to do so safely. But I know you can do this. I'm so proud of the work that you've done to date. Whether you work in cities or you're a farmer working in fields, or if you work at vineyards, I am so proud of what you have accomplished for our community. And I know if we each do our part, that together we will get through this and we will be able to move forward with our new normal. So really, that's what I wanted to have the opportunity to share with you tonight. It's just at 6 o'clock now, and I look forward to hearing your questions. And at this point, I think I turn it over to Philip Bransford to help me understand what questions have come in.
Thank you, Chair. And yes, we've asked earlier in the process of getting to your town hall this evening, if anyone had any questions that they could email us. We had several emails come in. Several came in about that piece that you talked about earlier concerning our ramp up of more contact tracers. And that seemed to be on Friday anyway, when you issued a statement, Chair, about our status with respect to the governor's criteria, prerequisites. It seemed back then that that was really the one that needed the most work from Washington County, getting more contact tracers. And we've had a handful of questions about that. Why does it take so long, apparently, if that's the only prerequisite that is that we're really having to focus on right now? At least it looked that way back on Friday. What is the process towards getting that prerequisite met that would take us all the way into the middle of June?
Thank you. That's an excellent question. We will be, there are two things I want to make sure I cover. Starting tomorrow, our staff is working on a new dashboard so that you'll be able to see where we stand in meeting these different prerequisites. You'll see further information about where we stand with the gating criteria as well. Right now, you can sign up for a daily email from the Oregon Health Authority so that you get the same information we all do on the instance of cases. We also have a regional dashboard that you can navigate to right from Washington County's COVID-19 page that shows you the cases from our 3 counties and where we stand. It's very difficult. We do still have new cases here in our community. We do still have people being hospitalized. It seemed like on Friday that we were satisfying the criteria for declining number of cases and able to handle the number of hospitalizations. But over the course of the weekend and today, we have had an escalation, an increase in the number of cases. So as I mentioned earlier, we're asking the Oregon Health Authority, OHA, did this increase mean that we have to start over? Or if the number goes back into the teens, as it has been, will we be okay? So we'll have to see, but this is where the dashboard will help us. On contact tracers, the second thing, these aren't just any worker that you put in front of a computer and give them a script of questions. We have to hire a bunch of community health workers to do this work. In addition, nurses. Doing contact tracing is complex work. And remember, we're asking people about the intricacies of their personal lives at a very difficult time. And like anything else, we have to follow up, because what someone remembers one day or one part of the day, they may remember more interactions later when they've had a chance to think about it more. So it's pretty intensive, and it's important that we are better staffed to do this work. The state also increased the expectations and the numbers that we have to be ready for. Our staff was working over the weekend asking OHA, well, do we have to have everyone on board all at once, or can we ramp it up? We don't have consistent answers to those questions yet, but our staff is working mightily. But we do know they've been working with different firms that can help us with the hiring and that can set up the payroll and the other systems that we need. It's going to be a minimum of a couple more weeks after we have a signed contract to get all that work in place. So that's where it really comes down to a few more weeks, folks, and that takes us out to early June. Worst case, I hope it's a worst case, the middle of June. I don't want us to have to wait until later in June. I'm as anxious as the rest of you to be able to get on with this. I want businesses to be able to reopen. And you know, we're going to get a flavor for that starting this Friday when more retail businesses open. Who knows? We may get a blip in cases that sets us back. So we have to wait and see a little bit. I'm sorry, but it's the best we can do. What next, Philip?
Okay, thank you, Chair. And Elizabeth, were you trying to jump in there? Okay, so I am proceeding to the next question that we got earlier in the week. This one had to do with isolation and quarantine and the respite site that the county had set up in Hillsborough, and just wanting to know a little bit more about that prerequisite, why it's important to have isolation and quarantine capability in the form of the governor's prerequisites, and how that particular site relates to the overall requirement.
Okay, thank you for that question. We have a couple of things that we have been doing and are prepared to continue to do. We have many families here in our community that are large families or multi-generational families. And under ordinary circumstances, everything works great. I know a lot of my neighbors have large families and multi-generational families. But with COVID-19, when you're sick, we really need you to have your own bedroom and to not have any contact with other family members. But what happens if you only have one bathroom or a small number of bathrooms for a large number of people? That means you're not able to quarantine yourself and stay self-isolated from your other family members. So there are some families where we've had to take that person and put them up in a hotel. Other families that have had to self-isolate together, we've had to be prepared to do groceries for them, to get their medicines, and to do so for an extended period of time. Because once one person is well, what happens if another member of that household gets sick? And remember too, this means then that people are out of work. And there are tremendous worries about how to pay rent or the mortgage. So it's very complex. This virus is an unwanted guest, and it has brought in living scenarios that so many of us were not prepared to handle. We're doing our best to try and get through it and to provide that community support. Now,
Great.
on the respite center, I forgot to move to that. We had to make sure that with our homeless population, that we ensured that they had more sanitary facilities. So with Stay Home, Save Lives, we closed libraries, coffee shops, restrooms in parks. All of a sudden, our homeless population didn't have a place to go to wash their hands or to use the restroom. That was very difficult on them. So we opened additional emergency shelters. We put in various locations throughout the county new restrooms, porta potties, sanitation, hand washing stations, and really tried to help the community get through. Some folks didn't want to go to the emergency shelter or to the shelters that we put together. Some of our community members did get sick and they went to the hospital. And then once they were well enough to be released from the hospital, they still needed to recover from the virus. So we rented out a hotel here in Hillsborough, the Comfort Inn, so that we had a place to work with our hospitals, so that particularly our homeless community members who still needed that time to recover, or if there were really vulnerable homeless members who tested positive or were at serious risk of contracting this disease, that we had a place for them to be safe and to be healthy. And our team has done a phenomenal job of supporting them, putting the systems in place so that people were self-isolated, but they had the meals that they needed. They had the support, that the laundry was taken care of, things like that. So those are the two aspects that I think that question was getting at.
Great. Thank you, Chair Harrington. And I just want to say thank you to everyone who has been on the chat. There's been a lot of great information being passed back and forth, and we so appreciate it. Erin Doyle, I'm going to have you ask the first question from the chat room. Thank you for helping with that.
Sure. Chair Harrington, could you address any specific guidance that the county is aware of for churches?
Churches. I'm not aware of that, actually. We'll have to follow up on that one. I do know that the governor has limited large gatherings, and right now, I think gatherings are limited to either 10 people or 25 people. Under phase 1, I do know that there can be gatherings limited to 25 people, but while still practicing physical distancing and wearing face coverings. Beyond that, the governor has told us all that large events, such as concerts and even larger gatherings, should be canceled through September. I believe under phase 2 that the proposal is to lift that gathering limit from 25 to 50, but there's an asterisk on that. And you can go to coronavirus.oregon.gov to see the presentation for the reopening and to look at that yourself.
Great, thank you. Jajit Nagra, can you please share one of the questions you found in the chat box for us? And I'll remind you, Jajit, to unmute yourself and make sure your camera's on. There you are, thank you.
Absolutely. So Chair Harrington, a couple of questions that we got on this subject matter is that with both hair salons and nail salons potentially opening in the end of this week, do you believe that is a safe decision?
Do I believe it's a safe decision?
So hair and nail salons, I believe, are considered personal services.
Right, so this Friday, retail businesses can open. But hair salons, nail salons, those fall under personal services. And that sector, like restaurants, has to wait until the state has allowed the county to reopen. So hair salons are going to take a little bit longer. I know I've cut my own bangs at least once already.
Thank you. Thank you, Jajit. Paige Spence, I know you've been monitoring as well. Can you please share a question? Thank you. Don't forget to don't forget your video. Thank you.
Sorry, thank you. Question from one of our participants. Will there be communication of confirmed cases at the zip code level at a minimum, and how well, it just says as well as contact tracing. So I think they're just asking generally about, breaking down the information that we have by zip code.
So the state has now published zip code information. You can find that on the OHA website. As far as contact tracing goes, no, we will not be releasing contact tracing information.
Great, thank you, Chair. And I've made a note to add that into the resource list when I send out websites at the end. Erin Doyle, you are up. I know there are a lot of questions being asked in the chat box. Do you have another for the chair?
Yes. one question was asked is, do we in the county have enough PPE for the caregivers?
So the county is responsible for making sure that there is enough PPE for first responders. Our EOC has worked to ensure that there is what we call a desk or staff working to make sure that there are the resources for PPE. And I wrote the numbers down somewhere recently and I misplaced it. There is both an email address for the EOC as well as a telephone number. So I know for a fact that there are some healthcare workers and vendors who are having difficulty getting access to PPE, and our EOC helped connect them up with a PPE supply. And that's what emergency operations centers are there to do. I'm sorry I don't have that email address handy to give you right now.
And I will for sure, again, add that into the list of follow-up resources that we'll be providing. If Aaron went, that means next on the alphabet is Jajit. So Jajit, questions for the
Chair Harrington, another question for you. Both small businesses and micro businesses have not received assistance to pay their rents and utilities. How can the county assist paying with 4 months of back rent and other costs such as lighting and utilities?
Thank you for that question. Like many local jurisdictions, our city specifically, Washington County has also looked at its resources and put together a small business recovery assistance program. We've had one round of funding and we'll look to see, and all of our communities are looking to see if there might be another round of funding. In addition, our state legislature is doing work to provide assistance, and our federal delegation is continuing to work on new legislation to help us as a community get through this very difficult time. Just today, the governors of our 5 state northwest or western area, Oregon, Washington, Colorado, Nevada, and California, wrote a letter to all of our congressional members asking them to please put forward a $1 trillion package for direct and flexible relief for states and local governments so that we can help ensure that we succeed together. And that is in addition to additional programs that the federal congressional delegation is working on to extend provisions that they've already adopted, such as the payroll protection program through the CARES Act and other relief legislation. So I know it's a very difficult time. We're all putting resources together. Washington County and the cities have been sharing resources and information. If you go to the Washington County website, you can find more information, not only on the county's website, but also on city programs as well.
Great, thank you. Paige Spence, a question for the chair from the chat box.
Yeah, Chair, this is Paige. This is a question, an issue I know you've been thinking a lot about. How do we protect our farm workers from the virus?
Good question. The Oregon Occupational Safety and Health Administration, also known as OSHA, has put together a set of requirements for many different occupations, whether it's construction or agriculture workers. So if you go to the OSHA website, you can find the guidance and information for those industries. But we here in Washington County have also been working with our community-based partners and outreach for our seasonal workers to try and ensure that they have access to support their basic needs. That includes healthcare, food, but also that they have proper sanitation, face coverings, and so forth. So it's an all hands on deck community effort. But if you provide farm worker housing, if you are an agriculture business, whether you harvest berries, have pickers for the wine grapes or others, strawberry pickers, for example, please look at the OSHA website on those requirements. And I just read today that there were apparently requirements that were going to be put in place starting today, and those requirements were pushed back to June. Nonetheless, we all need to be prepared, so please get familiar with those requirements right away. It's for things like making sure that there are sanitation facilities, that they're cleaned out multiple times a day, which are the same sort of things that we have to do with our restrooms in public buildings and in our parks, for example. Thank you.
Great. Thank you, Chair Harrington, for that answer. Erin Doyle, you're up.
Chair, this is a hard one. So do you know when Washington County will submit their application to reopen? It is one of only 5 counties who haven't yet applied.
Yeah, and I think all those 5 counties are probably the more complex urban, rural, combined counties, which means that we have a more complex situation to deal with. We are going over, as I mentioned earlier, the Board of Commissioners has recently received the draft reopening plan. We're going through that as a group discussion with our staff tomorrow during our work session. We do have some additional things to work on, so we don't know yet when we're going to be submitting our plan. We also have to get clarity, further guidance from the state on some of the particulars for satisfying the requirements. We want to make sure we submit a plan that will get approved. We don't want to submit a plan and have them reject it and have all of you disappointed. So that's why it's important that we get answers to these questions from the state and have the opportunity to be prepared. But here I am, the bearer of bad news, that it's going to take us a few more weeks to hire the contact tracers that we know. And that's if we're lucky, if our case numbers hold. But if, as retail opens, we have an increased number of cases and an increase in hospitalization, then all bets are off and we have to start over. And the clock would restart for 14 days. Let's all try to do our part and make sure we are as prepared as we can be.
Great, thank you, Chair. And I know that's a message you've been stating again in lots and lots of meetings lately, and I know it's a difficult one to share. Jajit, you're up.
Chair, can you comment on what plan or preparations the county is making for a potential second wave of COVID during flu season that could possibly be worse than the first wave?
Well, I'm not a public health expert, nor do I want to play one on TV or even in virtual meetings. I don't know is the answer. I know that experts from the CDC onward are very worried. They've been telling us that they're expecting there will be a second wave. Beyond that, we don't know.
Thank you, Chair. Paige Spence, do you have another question from the chat? And I also know Philip has some more questions. So Paige, after you, why don't we have Philip do one of the questions from email?
Sure, we still do have lots of questions that have come in from the chat, so thanks everybody for those. The next question is, most people have cars and the ability to drive to a different county for services. Are there any plans in place to mitigate things like Portlanders going to the beach during the weekend for a haircut?
Well, this is where, some of my worst nightmares. And I was just on a conference call with the three county chairs, Multnomah and Clackamas County, and myself, this is the kind of stuff we've been talking about, and we're very mindful that we know that our community members live their lives across county lines. We know at a minimum that we have a great number of people that spend the most of their time across our three counties. And that's why we're trying to make sure that we are fully prepared, all three of us. But it's also why the state has a health region of 6 counties. Columbia County, 72% of their residents commute for work into our 3-county region. They have no hospitals. They rely upon our hospitals. Clatsop County and Tillamook County, yes, they're to the east of us, and you may go and recreate in those counties, but they need to be prepared too. So we're all working together to try and make sure that we're working together. The folks on the coast, because of the overwhelming number of people that headed that way in advance of the Stay Home, Save Lives order, those boards of commissioners and those city councils had to not let people stay in hotels or short-term rentals. And they've had to put those plans, to reinstitute those plans. So they're going through that decision-making right now, this week. I don't think that all of the coastal counties will have things in place before Memorial Day weekend, but I know they're very anxious. On one hand, their local communities, like us, they want to get back to a new normal. But they also know that they have very limited healthcare capacity. So if their summer population increases tremendously, apparently just this weekend, a lot of folks from our community headed out to the coast, and they were overwhelmed. That is their worst nightmare. We have to help with that. We will get to the point where we will be able to go to the coast and enjoy the beach in coming days, just not yet. Please stay local. It's so important. I know it's hard. I miss going hiking tremendously. But it's what we need to do to save lives, to protect folks, to protect one another. I don't want any of my family members, none of my friends, none of my coworkers, no one I know, no one in my community to suffer. I don't want anyone to die, but it is happening. Please help us, just for a little longer, please.
Thank you, Chair Harrington. Philip, I think you have a question from email.
I do, and I have a different topic, if that's okay to shift gears a little bit for a moment. We got a question from Bob Frankenhauser about the waste management contracts in Washington County, the haulers in the different areas for our solid waste in Washington County. And the question had to do with why the particular company of waste management has the contract for such a large swath of the residential area where residents have to turn to their haulers in order to get their drop boxes. So is there more context around, I mean, is there any kind of competitive process at all involved with which haulers get selected for which areas of the county?
So in Washington County, the solid waste franchises are handled either at the city level or through the county cooperative. So for example, the city of Beaverton and the city of Hillsborough handle their own franchises. We also have a cooperative here in Washington County. So there is a system by which the local franchises are reviewed. That is the area that each different waste hauler serves. Because we know we've had growing population, we need to revisit that from time to time. Right now, during the course of this crisis, we're extending those deadlines. We're not going to be looking at changes to our franchises while we're going through this crisis because we have other more important work to do. We have quite an assemblage of waste hauling companies serving our communities, everything from Walker Garbage Service, Garbarino, just a whole slew of them. Waste Management isn't the only one. Pride, SWATCO, they're all throughout the county. So it's a robust system. They work with one another, so if they have any difficulties, they try to help one another as well. Frankly, our garbage pickup service is one of those truisms, one of those services that I could count on to keep going. So it brought me a sense of normalcy that the garbage person was still going to come and pick up my residential garbage. Thank you very much. And thank you to everyone in our waste industry for providing that service, for doing so safely, for making sure that your employees have been safe, that our recycling is picked up, that we avoid putting things into the landfill, but that those items that do go to the landfill continue to do so safely, not only for our population, but also for our environment. Thank you.
Well, thank you, Chair Philip. Thank you for that question. It reminds us that life still goes on even in the midst of all that's going on around us. Erin Doyle, you are up with. Thank you.
The next question is, the governor's constitutional authority with regards to her executive orders is being contested with at least one lawsuit filed last Wednesday. How will the county react if her authority is found to be in violation with her powers outlined in the Oregon Constitution?
Well, that's a what if that I can't really speculate on. Lawsuits and cases and judges, things will be argued and decided upon and determined upon. We have to make plans with the situation that we know it as of today, and that's exactly what we're doing. Should things change, then we'll adjust. But we have requirements that have been made abundantly clear to us. We're doing the requisite work to meet those requirements, and if something changes along the way, we'll have to adapt.
Super. Jajit, I know you've got a question pending from the chats.
Chair, are you aware, has there been any update on availability of antibody testing?
No, I'm not an expert in this domain. I know that is something that our federal level has been working on. We do know that we have more availability of testing here in Oregon. Specifically, the governor spoke last week about there being more of the test cartridges. But as far as the antibody serum type testing, I don't know. I'm not an expert in that at all.
Thank you, Chair. And I've added to my notes to add a list of locations in Washington County for testing and antibody testing that we have published. Jajit, so Paige, you're up next with the question. Thank you.
Sure, thank you, Elizabeth. I'm going to merge these two questions into one. Will every citizen be required to be tested, and will the county consider a potential vaccine mandatory?
It's a good question. Are people required to be tested? I do know that when folks show up to the hospital, that they're urged to be tested. I think there are certain folks like our first responders that we expect to have tested because, after all, that's part of the employment deal. You show up for work under different conditions, whether it be drug testing or otherwise. As far as individual civil liberties, I am not a lawyer, and I wouldn't try to address the particulars of that. But we can take it under advisement and ask our county council. I know there was another aspect of that that dealt with vaccines. That would come under the county's public health authority. For example, right now in our state, there's a requirement that school children complete a certain regimen of vaccines. So I would think that this would have to follow under that authority. Our public health authority is based off of state responsibility and state authority, so I would have to point folks to that level.
Great, thank you so much, Karen.
You guys are doing great on questions. Thank you.
There are a lot of great questions. And we're trying now, in the interest of time, to consolidate some of them into singular questions. And so please forgive us if we speak a little bit longer. I'm going to consolidate a number of questions, and these surround enforcement actions around non-compliance. So the basic question is what is the county and what will the county be doing for to enforce business closures? People who are attending areas that are already too crowded. For example, Hag Lake, after this really warm weather, was very popular this weekend. How can other folks help with people that they believe aren't abiding by, like, for example, not wearing a facial mask or keeping the 6-foot distance in a space like a grocery store? So what is the enforcement that's going on, and what are options for the local citizens?
Yep. Thank you for that question. And some of this is in place already, and we've been experiencing this already. If you go to the county website, co.washington.or.us, there is a COVID webpage. If you go to that webpage, you'll find information about enforcement and how to report situations that you think are unsafe. We have a team, an enforcement team working as part of the Emergency Operations Center that follows up on those reports. So as part of the draft reopening plan, it's a continued expansion of what they've already been doing. They get the report and they go and investigate. Now, in order for us to follow through, people need to give us information about the location, date, and time, and so forth. And so our team follows up. And if we have a complete report, they investigate it. For example, let's say it's a restaurant that doesn't have physical distancing in place. And this is just a hypothetical example that I'm using for illustration purposes. We would follow up and provide information to the restaurant manager or owner. And so the first one, think of it as a warning. Then our draft plan, then send them a letter with a warning. Then a second occurrence, we would follow up and likely have a face-to-face conversation and try and educate them and problem solve with them. And in the third situation, that's where we have to go to more robust enforcement. The good news is we have had very few cases of this. I'm hoping it will remain that way. It will remain that way if businesses follow their sector requirements. Go to the sector guidelines. That is the set of rules by which you get to operate without bother. Will our community members have questions? Might they be dismayed at someone's behavior? Well, that's where we all come in. We, as individuals, as customers, we need to be on our best behavior too. We need to be kind. We need to be respectful. We need to be responsible community members and do the right thing. Otherwise, you could get infected. You could get sick. Who wants that? That's no fun. Let's take good care of one another. But if you're a business person, you have sector guidance to get familiar with. And guess what, folks? Every single one of us, There's a sector plan for us too, right on that website I told you about. There's guidance for the public. You and I, whoops, sorry, hit the mic. You and I, each one of us, we make up the public. So guess what? We have responsibility here too. So please go to coronavirus.oregon.gov and get the guidance for yourself. For the public, it's there for employers, it's there for outdoor recreation, retail stores, it's there for restaurants and bars, personal service providers, malls. Guidance is forthcoming for gym. It's forthcoming for childcare, summer school, camps, youth activities, and transit, according to my review of that information just yesterday afternoon.
Great, thank you, Chair. And early on, I made a note to someone in the chat box that I'd make sure to send along the link to all that sector industry guidelines. So thank you for that reminder. Jajit, you're up, and I think we'll do one more round of questions and we're almost at time. So thank you, Jajit.
Chair Harrington, can you provide any information on the situation of COVID outbreaks at the congregate living facilities within Washington County?
That's a good question. Thank you. We hadn't talked about that much, had we? So congregate living facilities, examples, assisted living places, rehabilitation hospitals where people may go after surgery of any kind. So if there are two cases of, well, first off, if there is one case of COVID in a congregate living situation, including at the jail, for example, then our public health folks start engaging with that facility operator. If there are two or more cases, then we consider that an outbreak at that congregate living facility. And we watch that facility for 14 days minimum to try and make sure that the caseload doesn't grow, that it manages down. So it's really important that you have that assurance that we're paying attention. The list of facilities is published on the Oregon Health Authority website, on their COVID page. You can see it. So if you have family members at any of those facilities, if for some reason you weren't home and you didn't already get that notification from them, you can find out more right on that OHA site. But please know that our great team here at Washington County, our public health team and our emergency operations center, they do outreach to such facilities every single week. They have been engaged with them, even without reports of COVID, even without outbreaks, to try to make sure that they're prepared, to try to make sure that your loved ones and the employees of these facilities are safe and able to live safely. So thank you to all of the members of the Washington County staff and the emergency operations centers for doing that work. And a big shout out to all of the healthcare workers in all of these congregate living situations. We're so grateful and we thank you for your dedication.
Thank you, Chair. We have a question from Paige and then one more from Philip from email, and then we'll turn it back over to you to close.
Great. Chair Harrington, can you talk about our county jail? How many inmates and employees of the jail have tested positive, if any, and how many overall have been tested, and what other safety measures we may be putting in place in that arena?
I may not be able to get to all of the specifics that this question is asking about. So our sheriff, Pat Garrett, did a great job, engaged with all the sectors of our public safety team. That includes the district attorney for court cases, the judges, as well as juvenile justice, our community corrections center, and the jail. Our sheriff worked with all of the chiefs from all of the cities in Washington County to put together new protocols to limit the number of new folks that would be taken to the jail. There were early releases of folks. Some were released from the jail, but did so with ankle bracelets and other measures so that there was follow-up. But we reduced the jail population from, I believe it's 254 beds down to half of that. In addition, protocols were put in place so that new offenders that were brought to the jail, their temperature was checked and they were interviewed for other symptoms so that they wouldn't be introducing employees or other inmates to this virus. There was there were additional safety measures so that folks were essentially self-isolating, while also making sure that people had the outdoor recreation, that they still had access to their lawyers, so on and so forth. We made additional provisions through our community corrections facility as well to try and handle different scenarios. What you need to know is that because of these protocols, whether you're a deputy in the jail or one of our deputies in law enforcement on patrol, you've been successful. I think we had one deputy who tested positive, had started self-isolating as soon as that individual felt symptoms, so that we didn't have further spread to that individual's family or to his work group. So the team has done tremendous things. They've gotten their briefings through the computer as opposed to doing it in a team meeting. Where they have had to have team meetings, they've done so in the large cafeteria rooms so they could be practicing physical distancing. The small number of court cases that have moved through are practicing social distancing. For example, one of our rooms here in the county building is hosting a grand jury so that they have larger space to practice physical distancing. So the bottom line is the workload has been reduced, but work has continued. And we've tried to do so with physical distancing so that we're doing our part to flatten the curve, but to also make sure that we can get to the most critical work along the way so that you have a safe Washington County to continue to live in and work in. And I think I addressed the various aspects of that question.
Great, thank you. I think one final question from Philip, and then Chair, it's yours to wrap up.
Thank you. So, Chair, we got a question about trying to understand the importance of contact tracing, but why can't we in the community know the identities and locations of individual cases in the community? Why can't that be communicated? So we know that we have to ramp up on the contact tracing, but can the community also know about these individuals who may have become positive for this disease?
Well, the sad reality about any community, and ours is not immune, is that occasionally there are folks who victimize others and use information to harm others, to threaten others. And it's not kind. And I am not proud of the fact that it happens right here in Washington County. One of the first things that our team asked me to do is to do a public service announcement to get the word out that this virus does not discriminate, and neither should we. Because there were folks who were being threatened simply because of the way they appeared, their race, their ethnicity. We don't tolerate that here in our community. Your Board of Commissioners has adopted an equity statement. We expect everyone to be safe here in our community. We do not tolerate discrimination or stigmatization. This is a safe place. Everyone deserves to be safe and to feel comfortable to live in our shared community. As such, we know that we have to protect people's identities. Unfortunately, we have had families who've done the right thing and self-isolated, only to have other members of their neighborhood turn on them, say horrible things, and do horrible things. No one should be forced out of their home because they are sick. No one should be forced out of their homes ever, as long as they're obeying the law. So listen up, folks. This virus does not discriminate. We are going to continue to protect people because everyone deserves to be protected and deserves to be safe. I, for one, will not be voting to release people's private information because it's wrong. That's where I stand.
Chair, thank you so much. It looks like we've disabled the chat. So I just want to remind folks that if you have any questions, you can email them at chair@co.washington.or.us. That's also in the chat as well. When we share the slides with you, that you'll find that on the resource page. I'll go ahead and close out, and Chair, it's up to you to say goodnight to everyone. But thanks everyone for being so patient, and thanks for being here tonight.
Thank you very much for joining us on our first ever virtual town hall. It's been an honor to spend this time with you. I hope that you had the opportunity of information that you previously weren't aware of or didn't understand. This has been a big experiment for us, and I do look forward to receiving your feedback. Thank you again for the privilege of your time and your interest. Please know that you're very important to me and to my colleagues here in our community. We work for you because we love our community, we care about our community, and we endeavor to continue to do a great job so that you can thrive here in our Washington County. Thank you again, and be sure to stay tuned and pay attention to our COVID page on co.washington.or.us, as well as through our various social media channels. Thank you again. Good night. Oh, thank you, Miguel.